Okay. Welcome to another Zoom call. Reminder to keep asking questions on the member site. Years ago, we used to have people ask questions to their liaison, to Ann and Ashley. We ask that you don't do that any longer, that you ask the questions on the member site. Ashley is not even with us anymore. She's home with her baby now, and Ann has been working just very part time with her son's condition. So please ask your questions via the member site. And then remember that we'll answer your questions if you asked them. If you submitted a question between this Wednesday Zoom call and the Monday Zoom call, it will most likely be answered on that Monday Zoom call. So if you didn't get a chance to get on it, remember to look at that Zoom call. Watch it to get your questions answered. If you submitted a question between Monday's Zoom call and this Wednesday, of course, it's going to be on this one. At least we do our best to do that. Reminder again that all courses are available to all of you. It's the same login that you use to get on the member site for any of the courses. Okay, in addition to ovarian cancer, I have lymphedema. So lymphedema is common with many other cancers, many conditions. You could get lymphostasis. Do you recommend using a rebounder? How much time should I use per day? Currently do 5 minutes a day. So there's pros and cons to doing the rebuilder. I know the companies that sell the rebuilders, of course, they push all the pros to it. There is cons to doing it as well. If you know that you have metastasis to anything, to bone especially, you do have to be careful on the rebounder that you're not bouncing too much, because that force, it's a matter of physics with the trampoline. That force goes up through your joints again. And even though, well, I'm not pounding on the pavement, that's good, but you still get that rebound force that goes up through your spine. So if you have metastasis to the spine, especially, I don't highly recommend the rebounder. You have to be very careful with it, go very gently with it, or just do some walking on it. You could also use the rebounder in different ways, where you just get on it and do leg raisers, where you go up on your toes and down. You can do that on the ground as well, but sometimes it's a little, you do end up flexing different muscles when you're on a trampoline doing that. Just make sure you have something that you're holding on to. And also with lymphedema in the lower extremities, especially doing any sort of motion. So remember, your lymph system is an open-ended capillary system, and those capillaries do not have a heart to pump the fluid through like your arteries and your veins do. So they rely on contraction muscles. So anytime that you can do any type of muscular contraction, it doesn't have to be, it doesn't have to be even walking, certainly not running. You could just do muscular contraction. So even if you're sitting in a chair, that you're writing it out the alphabet with your toes, you're drawing a picture with your toes, you're using your imagination and drawing a picture with your hands with upper extremity lymphedema. You're contracting your muscles, you're moving your arms, you're moving your legs. That's the whole idea. So any type of motion is good. When you contract the muscles, you push the fluid through the lymph vessels, and then there's a one-way valve about every 2 to 4 inches, and it pushes the fluid through, and then it can't go back down. So that's the idea of getting fluid through your body. I think I have a couple of blog posts on moving lymph that can be helpful as well. There's a lot of information on Google on that, because there's actually some lymph specialists that are doing massage therapy work for lymphedema, which can be extremely beneficial as well. So lots of things to think about that can help with that. So how often should I do the rebuilder? It really depends on some of the things that I just mentioned. you can certainly do more than 5 minutes a day, and you certainly have to do more than 5 minutes a day of different muscle contraction exercises if you're really going to be able to move limbs. So you got to try to do it as often as possible. Some cancer groups were using 1/3 cup of baking soda and 1 cup of molasses and taking 3 teaspoons a day. Thoughts about using this method. We talked about this at the last Zoom call fairly extensively. So go back and listen to that, I would suggest. Because there's pros and cons to that. I'm not against doing anything, trying anything. You do have to remember, if you're going to be taking baking soda, you are going to be alkalizing your stomach acid. You will be hindering digestion by doing that. If you're going to do that protocol, I would highly suggest that you take HCl with your meals then, so that you can get your stomach acid back down to the pH that it needs to be in order to digest your food. Otherwise, you're going to end up with other digestive issues and possibly H. pylori. Unfortunately, I'm going to have to start radiation and chemo treatments. Can you recommend some tips to help minimize the side effects? Also, it is recommended to increase your protein intake during treatments. So if so, are there any specific protein types of drinks that you'd recommend? And if so, is one with whey or collagen okay? Or would a plant-based protein be better? If you're going to take protein powder, we recommend that you use the US Enzymes brand Proteinzyme. And the reason why we have chosen that for cancer patients is because of the low content of glutamine and methionine in it, which can be a feeder of cancer. But this has a very low content of that. It's also completely plant-based. It does not use whey, so there's no possibility of any dairy drivers in it. So it comes in vanilla or it comes in chocolate. So you're going to add this to a shake with berries. I highly suggest the vanilla. Otherwise, the chocolate is quite tasty. As far as a protocol for doing chemo and radiation, we do have a protocol to support those doing chemo. You can find it on our blog post. I think it's on the member site as well. It talks about doing a 24-hour fast prior to doing chemo. And then making sure that you're not taking a lot of antioxidants for at least that 48-hour window after the administration of the chemo. So I assume this person's talking about a chemotherapy IV. So that's what we're talking about, that 48-hour window. So the idea is that chemotherapy is an oxidizing agent, and taking an oxidizing agent, it's basically a poison. That's what an oxidizing agent is. So if you're taking an antioxidant, which, you know, everybody's trying to get antioxidants. Why? Because chemicals like toxins and pesticides and herbicides are oxidizing agents. They're poisons. That's how they kill little bugs, because they're poisons. And that's what they do to your body. And that's what they can do to a cell. And the reason why they're dangerous oxidizing agents can be cancer causing. So that's why we would take antioxidants. So you take, you know, fresh fruits and vegetables have a lot of antioxidants in them. So you're taking antioxidants by eating correctly. But there are antioxidant nutrients. Vitamin C would be considered an antioxidant. Alpha-lipoic acid would be considered an antioxidant. Glutathione and glutathione precursors would be considered antioxidants. Well, that's why an oncologist will say, I don't want you taking any of your supplements. We're going to do chemo. Well, what they really mean is they don't want you taking antioxidants. Because if you're going to do chemo, an oxidizing agent, you don't want to negate the effects of the chemo. So I'm not knocking chemo just because it's a poison. I'm just saying you don't want to be taking an antioxidant while the chemo's trying to work. So you lay off of those, nutrients that are highly antioxidative in their nature. So you wouldn't take vitamin C, you wouldn't take curcumin, you wouldn't take alpha lipoic acid, you wouldn't take glutathione for 48 hours post chemo. So say I go in and do chemo IV at 9 o'clock Monday morning, it lasts till noon. So I would wait till noon on Wednesday before I take those types of supplements. In the chemo protocol that's in our blog, we also caution against taking things that will really push the detoxification pathway, because that's another argument that an oncologist would say, is that I don't want you taking a bunch of, support for phase 1 and phase 2 detox in the liver, because we're going to put this chemo in you and you're just going to detoxify it, Well, hopefully you're going to detoxify it, but they don't want you to detoxify it while it's really doing its work. And there's a lot of talk about out there for years that chemo really does its work on the cancer in the first 48 hours. That's why we say a 48-hour window. So you don't do, you maybe even lay back off of your liver support products for 48 hours, then you do it again, in my example, at noon on Wednesday, you take those liver support products again. And then doing a 24 or even 48-hour fast prior to doing chemo can be extremely helpful. We have had numerous patients that have done that and said it really helped minimize the side effects. We also have a radiation homeopath for radiation. That's this right there. Nothing is going to be perfect to pull out radiation. This is just a homeopath that will help. Okay. In September, after a CT scan, I was told it appeared I was in remission from ovarian cancer. Yesterday, I had a follow-up PET scan. More cancer was found. I meet with the oncologist tomorrow. Any recommendations or questions to ask? I do not know what she'll recommend. Cancer was found around the liver. So, yeah, this is why, I've said for decades that, CT scan and PET scans are great, and they are gold standard. Still, they're not going to show there's any cancer if it's under 3 billion cells large, meaning that you could have cancer that's 2 billion cells large, but it doesn't show on the CT scan nor on the PET scan, and you're given a clean bill of health. That's why you just never, I hate to be I'm not being a pessimist, I'm just being a realist. I mean, you should just never assume that you're cancer free. I mean, you just shouldn't. You should just assume that, hey, even if you don't have cancer, even if you've never been diagnosed, you should assume you have cancer. Then you should be treating yourself as if, because it's just true. So, and I'm not, I'm not saying you ever stop doing anything that you were doing beforehand, but there's been times where that has happened, where people thought they were cancer free, so they stopped doing everything. And the cancer, quote unquote, came back with a vengeance. Well, it was never really gone. It rarely really is ever really gone, and you have to keep treating as if. That's the wisest thing to do. I know, personally, I feel like I've been in remission, and I lax off on my diet more than anything. And I keep taking my supplements, and I keep doing the right everything. But I'm horrible with my diet. I've always been horrible with my diet. And that's not a good thing. And I'm reminded, every once in a while that I need to get better, especially when I have gut pain again. I need to get better and be more disciplined. I have to keep praying for that. I'm horrible with that. So any recommendations or questions to ask? I would just hear them out, see what they say, and then just politely say, thank you very much. I'm going to get back to you, and I'm going to pray about this and decide what I want to do. So they may, I don't, I don't have your chart up. I don't remember what their initial recommendations, but what do they have? They have really three tools, they probably will not do radiation, but they may want to do biopsy. I wouldn't recommend doing that, but they may want to do chemotherapy. So, and then you say, well, okay, well, let me think about it and pray about it, and I'll get back to you, and then go home and do some of that and some research, and certainly you can have a conversation with me and we can talk about it too and look at those scans. I do coffee enemas every other day. After it's done, I feel tiredness coming to my legs for a few hours, then it goes away. I do take minerals and make sure I'm not dehydrated. What is the reason for the tiredness? I would doubt that it's anything to do with dehydration. Coffee enemas really are drawing a lot of water from your body to your colon. That's not really what they do. So I would doubt that it was that, and I certainly would, on that same physiological basis, highly doubt that there's any demineralization of your tissues due to the coffee enema. There's just no evidence of that anywhere. So the achiness, tiredness in your legs could very well be neurological. When you do a coffee enema and you're putting a tube up your rectum, stimulates, of course, the neurological pathways back to the lumbar and sacral plexus, which could cause, reflex fatigue in your muscles that are coming out and innervated through that same plexus. So it could be neurological. More likely than that, it's a parasympathetic stimulus. So understand your purpose of doing a coffee enema is to stimulate the parasympathetics. Well, what does the parasympathetic nervous system do? Well, the parasympathetic nervous system stimulates an immune response. Yay, that's a win. Parasympathetic nervous system stimulates a detoxification response because neurologically, your detoxification pathways are controlled by your parasympathetics. Parasympathetics are also calming response. Think of everything that your sympathetics do, and the parasympathetics do the opposite. So what do the sympathetics do? Your sympathetics are your fight, flight, or freeze mechanism. Polar bear jumps down in front of you. Your blood pressure goes sky high to shunt blood to the extremities so that you can run away from that polar bear or fight. Your adrenals kick into full gear and you go into full fight mode, and you're trying to survive. You're in survival mode. When your parasympathetics are calming, you're relaxing, decrease anxiety, they decrease your blood pressure, they decrease the shunt of blood to your extremities. That's what you want to kick in. That will help you relax and help you go to sleep. So really your response is probably more a parasympathetic response, which is actually good. So the tiredness you feel in your legs, that's why we suggest doing the coffee enemas in the evening so that you can just go to bed afterwards if you have to. The only negative about that is people that are highly sensitive to caffeine, the caffeine could keep them awake. But most people tolerate that pretty well. They're not absorbing a ton of the caffeine, especially if you're not dehydrated, and you don't have the issue with that. Even though cancer was found in my scan, my CA 125 score was only a 5, which is the best score I've ever gotten on that test. Is that an indicator that my body has low inflammation? No, your CA 125 is a tumor marker test. Your high sensitivity C-reactive protein is an inflammatory test. So a CA 125 score of 5, that's your lowest score that you've had on that, tells you that that's an indicator, one objective finding that your cancer is getting better. So then this is why you don't even look, okay, the PET scan is the gold standard and we see a hot spot on your liver, so we need to do something. My question is, do I really? That's just one indicator. This is where you use your, you have to go through kind of that questionnaire of yourself. Okay, am I more tired than I am? Do I have any more pain? Do I feel worse? These subjective things are just as important. So really analyze your body and go, you know, if you have a PET scan and it shows some hot spots on your liver or elsewhere in your body, does that always mean that that it is cancer? Well, yes and no. It doesn't always mean that it's cancer. It's another indicating factor that there's cancer there. But then you have to weigh that out with other things, your other subjective findings and your other objective findings. Well, my tumor markers are continuing to drop. How can that possibly be? It can be because there always was cancer there, but the PET scan never picked it up before. And it's actually could be actually better than it was, 6 months ago. So it doesn't mean that you need to jump into another course of care from standards of care protocol or anything like that. You have to weigh out any objective finding with other objective findings and with objective findings, meaning, well, I'm feeling, let's say the case was, hey, my CA-125, meaning my other tumor markers are better, and I'm actually feeling great. I feel like I have more energy. I don't, then I might say, well, maybe we'll run this test again in 3 months or 6 months or so, and weigh this all out. You don't just use one test to determine something. All these things have negatives to them. They can show false positives, and tests can show false negatives too. So you want to weigh all these out. You don't want to put all your eggs in one basket. But again, I would go, have your meeting with your oncologist, see what they have to say. If they're reasonable and not just a technician of a practitioner, then they would do the same thing. I think it's what I'm telling you is to be reasonable. Like, oh, well, this is positive. Could this have been missed before? Yes, the tests, there's plenty of evidence that it could have been missed before. My other tests are doing well. My blood is doing better. This is doing better. I feel great. I'm sure they're not going to push you down a course of actions that you don't want to go either. So how many chemo drug types are there to treat pancreatic cancer? And do you think low dose chemo treatments work better than normal dose? Well, I'm not an oncologist or a pharmacologist, so I don't know how many chemo drug types there are to treat pancreatic cancer. So I apologize, I can't answer that, but I know you could just probably Google that and get a fairly fair statement about that. And do I think low dose chemo treatments work better than normal dose? No, I don't think they work better. I think they can be better for some people. So why let's rephrase that maybe. Why would a person want to do low dose chemo, insulin potentiated chemotherapy is what we're talking about, versus doing regular full dose chemo? What are the pros and cons of that? And I'm just giving you my opinion. So the pros of doing full dose chemo is if you can tolerate it, and meaning is it well tolerated, meaning the side effects of it isn't destroying your body, then to me that would make more sense, because you're going to hit it hard and you have a better chance of really knocking yourself into remission. The problem is that many people don't tolerate it. Many people, the truth is, let's just be honest, a lot of people that do chemo are killed by the chemo. The chemo is what killed them. The chemo was their demise. That's what brought their body down. I shouldn't say many. There's a percentage. Okay, so a percentage, whatever percentage that is, no one will ever find that data because they'll never do a fair study about that. But there is a percentage of people that the chemo is their demise. But that's certainly not everybody. You know, it's people with more compromised immune systems, people with more compromised health, people with other comorbidities, people with you know, compromised detoxification pathways from a genetic perspective and a tissue injuries perspective. Let's say they, you know, consume more alcohol than they should have in their life. They were exposed to more toxins than they should have in their life. So they have damage to the liver already, and they have a compromised liver. They're not going to be able to detoxify the chemo well. Um, or people that just have a genetic predisposition that they don't detoxify the chemo well. They have defects on their NAT pathways, their cytochrome P450 pathways, and their PON1 pathways, a lot more people than other people do. So there's compromise there. They don't detoxify it well. They're going to have more issues with chemo. But there's some people that detoxify it very well, and they could go through chemo and they can sail through pretty well. Those people, you know, tend to have, you know, better results with the chemo. Also, there's cancers that don't respond to chemo. I don't care how much chemo the person can tolerate, the cancer doesn't respond to the chemo. If that's the case, then it's not going to respond to insulin potentiated low dose chemo either. So if your cancer doesn't respond to full dose chemo, it's not going to respond to insulin potentiated chemo unless they're using a completely different drug. So that would be something that's common to both. But there's some people that just don't tolerate chemo, or they believe they're not going to tolerate chemo well. And some of the indications are, well, I don't detoxify any drugs well. I'm not good with any drugs. It seems like I just don't, I react to them. It seems like, you know, I can hardly take Tylenol without feeling sick. You know, I just know I don't detoxify medications well at all. I don't think I'll do well with chemo. Those are the people that would, you know, that where low dose insulin potentiated chemotherapy would be a perfect fit because you're giving about 10% of the dose of normal dose chemo while doing an insulin push beforehand, which will cause the cancer to help uptake the chemotherapy better. Thereby, you could use a lower dose. That's the whole idea of insulin potentiated chemotherapy. Well, it's not while insulin potentiated chemotherapy sounds real great to do, it has some negative things as well. Number one is what I already spoke of. If the cancer isn't going to respond to any chemotherapy, it's not going to respond to the insulin potentiated low dose chemotherapy either. The other negative is you have to do a far more sessions. So usually, unfortunately, because there's few and far between clinics that actually administer insulin potentiated chemotherapy, you have to travel to a place, typically in Arizona, and there's another place in Michigan that does it. You have to travel there and stay there. So you have to basically go there and, you know, rent a condo for 3 months because that's how long you're going to be there doing it. So that's a negative in a way because, well, I'm trying to save my life, so that's not a negative. Well, that's okay, but you're going to be away from home. If you have little kids at home, it's very difficult to uproot your family and do something like that. So that's a negative. The positive is you're not going to get as sick. You still can lose your hair. You can still have side effects, but you're not going to get nearly as sick as you would if you were doing full dose chemotherapy. So there's pros and cons to each one. So I wouldn't say if something works better. I'd say it's a different application that fits different people's needs better. So um, uh, that would be my answer to that question. Hopefully that helps. Any other questions? Any comments on the Mexico immunotherapy clinics like this one? No, not really. I mean, we've had patients go to many different clinics in Mexico prior to coming to us, and we've had them go to them while they're working with us. Um, we haven't really heard, I mean, I'm sure we've heard some negative comments, but in all, most of them positive. Um, and if there was any negative over the years, all of my years of doing this, don't remember at all what clinics they were that were negative, because there's other people that said very positive things about it. Most in general, everybody had a very positive experience. Um, so some of them offer different things. So look and see what they offer. I don't think there's a lot of value just going to like the Gerson clinic where you're going to go down there and for 2 weeks, you know, they're going to juice for you. Um, but the clinics that offer a bunch of different types of therapies, and there can be great benefits. So um, we've had a lot of people with very positive experiences. All right, I think we'll call it for tonight, and we will see everybody back on Monday. Hope you guys had a great Thanksgiving last week, if you went on Mondays, and that you have stress-free preparation for Christmas. That's the whole idea, right? Know that I'll be praying for all you guys. I love you all, and I'll see you in about 5 days. Bye-bye.